Welcome to another session of Earth Information System. Last week, I think we discussed about the benefits of Earth Information System. We talked about the functions of Earth Information System. We talked about the features of Earth Information System. And we are able to talk about introduction to Excel. Introduction to Excel. All along, we've also talked about early warning and prediction and some other things under Earth Information System management. So today we want to look at some areas in computer. I'll just put the heading as hardware, software, and the roles of support personnel. Hardware, software, and the roles of support personnel. Hardware, software, and the roles of support personnel. You see, computers are becoming increasingly popular every passing day amongst a wide section of people. Computers are becoming increasingly popular every passing day amongst a wide section of people. Now, we will need to know the uses of a computer. And before we go into knowing the uses, I think we need to know what computer means. We need to know what computer means. Hold on, I'm coming. We need to know what computer means. So, let me give you a definition of computer before we go ahead. Computer can be defined as an electronic device that is designed to automatically accept data, store, and process, then producing output results. I repeat, computer can be defined as an electronic device that is designed to automatically accept data, store, and process, then producing output results. Then produce output results. Okay? So when we are talking about computer, in medicine, including hospital information system, data analysis in medicine, medical imaging, laboratory computing, computer-assisted medicine, medical design making, care of critically ill patients, computer-assisted therapy are areas where we can make use of computer. So you can use computer in those areas. Very useful in those areas. In medicine, data analysis in medicine, health information in the hospital, imaging, laboratory, computer-assisted medical decision making. All of these areas you can make use of computer. When you say compute, that is to calculate. When you say you want to compute, that is you want to calculate. You see? And I want to tell you, I want you to note this name, the father of modern computer. The father of modern computer. They call that man Charles Babbage. Charles Babbage. Charles Babbage, spelling B-A-B-B-A-G-E, Charles Babbage, the father of modern computer. So we want to now look at components of computers. Components of computer. You remember that the subheading we are talking about has to do with software and hardware. So we want to look at components of computers right now. And hardware is number one component. Hardware, what is hardware in computer? Is the term given to the physical components of the computer system, and it is divided into 3 units. I want us to listen carefully in these areas. Hardware is the term given to the physical components of the computer system, and it is divided into 3 units. That is, hardware in computer is divided into 3 units.
Mr. Koro, please unmute yourself.
All right. Are you hearing me now? Can you hear me?
Yes, yes, yes,
Okay,
yes.
sir. Okay, let me start fresh here. Hardware is the term given to the physical components of the computer system. And I said hardware is divided into 3 units. Number 1 unit is the input devices, which converts the data to be processed into a format acceptable to the computer. Input devices converts the data to be processed into a format acceptable to the computer. Example, the punch cards, the magnetic tapes, and the keyboard are examples of these input devices. Number 2 units within the hardware is the central processing unit. They call it CPU. Central processing unit, CPU. It is the brain of the computer. The CPU is the brain of the computer. All major calculations and comparisons are made here, are made in the central processing unit. It has 3 constituents: the memory unit, the control unit, and the arithmetic logic unit. I want us to note this very, very, very well, because you may be asked to identify the 3 units under hardware. And while you are identifying these 3 units, you have to explain them. And under this CPU, it has 3 constituents. You may also be asked to identify the 3 components, the 3 constituents, or the 3 major things that constitutes the CPU. That is why you need to understand this area very well. Hardware has 3 units. The CPU has 3 constituents on its own. So you may be getting 2 or 3 questions from this question alone, from the hardware thing alone. So you have to be very careful in this area. So the control unit, the memory, and the arithmetic logic unit. Then the last unit under the hardware is the output devices. The output devices accept the results produced by CPU and supply the results to users. The output devices accept the results produced by CPU and supply the result to users, e.g., the printers, the visual display units, and some other things like that. Okay, let us go to software. The software are the set of programs that control the activity of processing by the computer. The software are the set of programs that control the activity of processing by the computer. These areas I'm treating with you this afternoon is very, very important for you as 400 level students. You need to understand this area very well, even though you are not a computer technologist or expert. But you still need to understand this area very well, even though you are not going to do the practical aspect of it. But you need to understand it theoretically and understand the constituents, the units, and everything we are talking about under this computer system. Now, software, like I said, are the set of programs that control the activity of processing by the computer. Then we have some types of software. We have some types of software. Number one, we have system software. System software. System software. These are a collection of programs which allow the user to interact with the computer hardware. These are a collection of programs which allow the user to interact with the computer hardware, e.g., operating system like DOS, Unix, and computers like C Fortran, COBOL, and BASIC. Don't bother yourself with all these names. Just understand that system software are a collection of programs which allow the user to interact with the computer hardware, e.g., operating system. Just leave it like that. Now, the second type of software is the application software. Application software. This consists of programs which perform special functions for the user. This consists of programs which perform special functions for the user as word processing, data processing, and spreadsheets. So we have two types of software. Two types of software, and hardware is divided into three components, into three units. And of course, the CPU itself constitutes three major things. So we are having hardware and software. Hardware has three units, which is input devices, CPU, the output devices, while the software is having system software and application software. Okay. What do we mean by saying computer techniques in medicine? Computer techniques in medicine. Hospital information system. I want you to note this. Hospital information system. Hospital information system. What do we mean by this? Hospital information system. It generally covers areas like registration, like admission, like transfer, like discharge, like medical records, like wards, operation, theater, scheduling, and the rest. That is what we mean by hospital information system. Those things that you need under the information system of an hospital. Transfer, discharge, and all other things that needed to be documented. Then there is something we call data analysis in medicine. Data analysis in medicine. Don't forget, just take note of this very, very well, very important in your course. Hospital information system, you might be asked to define it, or you might be asked to explain it, either of the two. Then we have data analysis in medicine. All I am giving out here as lecture are keynotes, key things that you must need for the material. And that is the reason why you need to listen attentively. And that's another reason why you must be in attendance. Data analysis in medicine, it has to do with collection and analysis of data. Data analysis in medicine has to do with collection and analysis of data. Let's go straight to budgeting with Excel. Budgeting with Excel. Budgeting with Excel. Whether you are a small business or a large corporation, budgeting is a principal business process. So budgeting with Excel is a process that can be used for decision making. It's a process that can be used for decision making. And so as a management tool and to improve your financial performance, it's a process that can be used for decision making and as a management tool and to improve your financial performance. So you can use budgeting with Excel for that. A process that can be used for decision making and as a management tool and to improve your financial performance. How does budgeting present formidable challenge to many companies? This is a question now for me and you. How does budgeting present formidable challenge to many companies or hospitals? In many organizations, the budgeting process is seen as one. It is annoying, very annoying. Number two, it is confusing. Number three, it is burdensome. Number four, it is time consuming. Those 4 points, you must note them very well. In many organizations, budgeting process has been seen as annoying, confusing, burdensome, and time consuming. Time consuming. We still have almost about 20 minutes, so we can quickly use that to treat one or two things again. Now I want to look at elements of change under the strategic planning. I want to look at elements, key elements of change. Key elements of change. Key elements of change. You see, understanding change is crucial to implementing quality improvement initiatives. Understanding change is crucial to implementing quality improvement initiatives. So what are the key elements for change? Number one, you need to develop a vision for change. You need to develop a vision for change. Number two, you need to have focus on the change process. You need to have focus on the change process. Number three, you have to analyze which individuals in the organization type have and receive coverage. You have to analyze which individuals in the organization that must respond to the proposed change and what barriers must be existing. You must be able to analyze those individuals in the organization that must respond to the proposed change and the barriers to exist that will exist. Number four, key elements. You need to build partnerships. You need to build partnerships between physicians and the administration. You need to build partnerships between physicians and the administration. The next point, you need to create a culture of continuous commitment to change. You need to create a culture of continuous commitment to change. Another point, another key element, you must ensure that change begins with leadership. You must ensure that change begins with leadership. Okay? Then you need to ensure that change is well communicated. You need to ensure that change is well communicated. I believe you are noting these key elements. They are more than 6. The last one here is that you must be able to build accountability. You must be able to build in accountability for change. You must be able to build in accountability for change. You must be able to build in accountability for change. The next thing here, I will treat this in the next 4 minutes. Maybe we'll continue on it again by next week. We'll be looking at impacts for professional development and tracking quality of patient care. You see, an effective teamwork is globally recognized as an essential tool for constructing a more effective and patient-centered healthcare delivery. In fact, let me just stop here on the introduction, then we'll continue next week by the grace of God. Let me stop here and we'll continue next week by the grace of God. So I'm giving room for question now. We have about 15 minutes more to go. Rather 30 minutes more to go. Question. Question.
Good afternoon, sir.
Good afternoon. You're welcome.
Yes, sir. I'm regular from the Kodo Center.
Please speak louder, please.
Hello, sir.
Yeah,
Hello, sir. Can you hear me?
I'm
I'm
hearing
regular from
you.
the Kodo Center.
Huh?
Please, sir. I don't really have much question, but I want to ask, sir, if we need the material, how can we get the material for this course?
But you are seeing it on the screen, Abby.
But not everything we're able to get. All what you said, I was only able to jot down some, but everything is not on the screen. And the previous one too wasn't on the screen. So, and I was unable to attend the
Were you
class
in
last.
class right from the beginning of this lecture?
Sir?
Were you in the class from the beginning of this lecture?
Yes,
Or you
sir. But the second class, I wasn't on. Sir?
You weren't in the class.
Hello?
You weren't in
Last week
attendance
alone, only last week.
at this lecture today now.
I'm in attendance. I attended the class today.
I think I took
Yeah.
time to explain more than two times, explaining all the key things.
That's why
Okay.
I said if you can help with the material, just to sit back and go through it.
Don't worry, I will ask Mr. Yomi as to the way out. Okay.
Okay, sir. All right. Thank you, sir.
Thank you, sir.
All right, sir.
Just
Thank you.
advise you. I will just advise you.
Sir?
Just listen. I will
Okay.
advise you. Just listen carefully when I'm explaining those key things. Okay. Okay.
All right, sir.
Once you are able
Yes,
to
sir.
get the key thing, as I'm talking, just note everything I'm talking about. Once you understand the key thing I'm saying out, you are safe. Okay?
All right, but sometimes you're fast with your dictation.
And that's why you need to call back. That is why you need to call back.
Okay.
I normally give
I
10,
can't
15
call back
minutes
because
for
I can't call back because we already been muted. So
that's why
until
I'm
we are
giving
on mute, you call.
10 minutes for question time, so that we'll be
All
able
right,
to
no
talk
problem, sir.
areas. But nevertheless, don't
All
worry.
right, sir.
I will see how I can.
Okay, sir.
I'm only trying
All
to
right,
make
sir.
things easy for us. But at least you've seen the differences in hardware, software.
Yes, sir. Yes, I was able to get that.
All right.
Thank you, sir.
12.
All right, thank you, sir.
Hello.
Hello.
Hello. Good
Hello. Good
afternoon,
afternoon.
sir.
Good afternoon.
Comfort me on the line, sir.
Who?
Please, sir, I came in late to the
Okay.
class, so I could
All right.
not really get most of what you said.
So what do we do now? Because we are supposed to be in class even before I get there.
The thing was not connecting. It was poor
Anyway,
network, sir.
question. Go ahead with your question now. At least you met us
Like
somewhere.
okay, sir. Like when
Yes.
you talk about how to collect the analysis in medicine, what were the composition of them?
I can't get you very well.
Analysis in medicine, what were the composition in it? When you talk about hospital,
Data analysis. Data. You know,
I could
I
not
talked
really
about
get it
computer
because I
techniques in medicine. Okay.
okay.
I talked about the
Yes, sir.
computer techniques in medicine. And you spoke about
Okay.
in we have hospital information system, and we have data analysis in medicine. So data analysis has to do with collection and analysis of data. Those are information you need in the healthcare setting or in the healthcare settings.
Okay.
Can you get me? All the information you need in the hospital setting
Okay.
are referred to as data analysis.
Okay. Data analysis.
Yes, in medicine. You know, in every field of specialization, everyone has a way of collecting data. Okay? Even
Yes,
as
sir.
students, when you are writing your project or your research work, there is a way you will collect your data. Are you getting it? So also in medicine, we also collect data.
Okay.
And we analyze it. Okay.
All right, sir. Thank you
All
very
right.
much, sir.
Thank you.
All right, sir. I want to ask a question, sir. Sir, my name is Israel. Good afternoon, sir.
This guy from which center is that?
Igbo Learning Center.
Igbo Learning Center. Okay.
Yes, sir.
Go ahead.
I saw under the hospital information system, CSSD. Can you throw more light on that?
That is under computer techniques. Yes.
Can you hear me, sir?
Yes.
I mean, under the hospital information system, I saw CSSD. I want to know the meaning. Can you help us throw more light on that, sir?
You see, I've told you, don't bother yourself too much. You are healthcare management students. Are you getting me? You are not computer science students. So let us limit ourselves to what I said concerning computer information system. I said it generally covers areas like registration, admission, transfer, discharge, record, and so on like that. Don't bother yourself about the abbreviations that I wrote. Okay?
Okay.
Do you understand me?
And so we wanted to know, since you say it talks about registration, okay, admission, registration, and all the rest, we need to understand those terms because it's how that is the major core of the hospital information system. For instance, we go to a hospital and then they are mentioning CSSD, they are mentioning index, they are mentioning
healthcare officers when you get there. Okay? Even when you go for your IT, nobody will bother you about that. All right?
Okay, sir. Okay, sir.
You can for it on your own. Are you getting it?
Yes.
You can the language. You can just research on it for your own understanding, but don't bother yourself concerning exams. Okay?
Yes,
just understand what two information system means. That's why I don't want to bother you with these other abbreviations. All right?
Yes, sir.
I don't want to overload your brain with other things.
Yes, sir. Thank you, sir.
Thank you.
Hello, sir.
5 minutes, yes.
Hello,
Yes,
sir.
Yes, hello.
Hello.
Hello, I'm listening
Please,
to you.
how can we get the handouts for this topic, sir?
You know, I will speak with Mr. Yomi.
Okay.
I will speak with Mr. Yomi and I will know what to do.
All right, sir.
Okay?
Okay, sir.
Can you hear me?
I'm hearing you, sir.
Can you hear me?
Yes, sir.
Hello?
Hello, sir. I can hear you loud and clear, sir. Hello?
Hello, yes.
I'm Comforting Yang, calling from Igbo Learning Center. I was asking on how we can get the handouts.
That is what I'm just telling you now. I said
Okay, sir.
I will confirm that from Mr. Yomi, and
All right,
I will
sir.
know what to do. Okay?
Okay, brother. All right,
But
brother.
I am very sure you listen very well to the lectures.
I came in late, sir. The network was
Yeah,
bad.
very unfortunate. It is well.
All right, sir.
Okay. That's why I want to make
All
sure
right.
we finish these materials on time so that there will be enough room for us to do revisions. Okay? So that people that miss
All
the
right, sir.
lectures will be able to come up with some information. Okay.
For why did you today you come in and he was pretty sure that he and Andy were friends. Maybe he was like,
We still having 3 minutes to go.
because I did clever for ask questions, so I don't admit myself.
Unmute yourself so that you can, yes, unmute yourself so that you can ask.